Have you ever wondered what the top 10 deadliest diseases are? We're about to take a dark and intriguing journey that will send shivers down your spine. Throughout history, these silent assassins have claimed countless lives and still lurk in the shadows, posing significant threats to humanity. From ancient plagues to modern pandemics, these diseases have carved their names into the annals of our world. As we delve into this chilling countdown, remember, knowledge is power. Ready to dive into the world of deadly diseases? Brace yourselves. Kicking off our countdown at number 10, we have malaria. This is a nasty disease transmitted through the bites of infected mosquitoes. It can cause fever, chills, headache, and even severe illness if not treated properly. Globally, it's a real menace. Each year nearly 290 million people are infected with malaria, and more than 400,000 people die of the disease. So next time you swat away a mosquito, remember it's not just about the itch, but you are also saving your own life. How do we avoid malaria? Use protective clothing, bed nets, and insecticides that will protect you while traveling. It is also advisable to take preventive medicine before, during, and after a trip to a high-risk area. At number 9, we find ourselves face-to-face with HIV/AIDS. This formidable opponent is a viral infection that attacks the immune system, making it harder for the body to fight off diseases and infections. HIV is spread from the body fluids of an infected person such as semen, vaginal fluids, breast milk, and blood. However, it is not spread by kisses, hugs, or sharing food. Symptoms of HIV vary depending on the stage of the infection. Most people have flu-like symptoms within 2 to 4 weeks after infection. The infection weakens the immune system, which can cause other symptoms such as fever, diarrhea, weight loss, and coughs. Without treatment, people with HIV can develop into severe illnesses such as tuberculosis, cryptococcal meningitis, and severe bacterial infections. Globally, it's a relentless adversary, with millions affected every year. In 2022, around 630,000 people died from AIDS-related illnesses. However, despite its grim reputation, it's not invincible. We can reduce our risks by doing the following: use protection during sex, avoid sharing drug injection equipment, and get tested for HIV. Sliding into number 8, we have tuberculosis. Tuberculosis is a serious illness that mainly affects the lungs. It can spread when a person with the illness coughs, sneezes, or sings, which leaves tiny droplets with the germs into the air. Another person can then breathe in the droplets and the germs enter the lungs. And here is the kicker: even if you're not showing symptoms, you could still be a carrier, infecting others. This sneaky bacterium is your lung's worst nightmare, causing a really bad cough that will make you cough up blood and phlegm. You can also expect to experience chest pain, fever, chills, and tiredness. In 2022, around 10.6 million people were infected with tuberculosis worldwide, and a total of 1.3 million people died from tuberculosis in 2022. It is the second leading infectious killer after COVID-19. How do we prevent it? We can protect ourselves through vaccination, early diagnosis, quarantine, and medication treatment. Having a good hygiene is also important in order to stop the spread. So, be a good sport, wash your hands more often, and get tested if you've been exposed. Remember, an ounce of prevention is worth a pound of cure. Keep those lungs healthy, folks. At number 7, we have hepatitis. A real party pooper, hepatitis is the swelling and inflammation of the liver. Hepatitis symptoms can include fever, fatigue, loss of appetite, nausea, jaundice, and abdominal pain. There are several types of hepatitis. The most common types of viral hepatitis are hepatitis A, B, C, D, E. There are also non-viral causes of hepatitis such as autoimmune hepatitis, alcoholic hepatitis, and drug-induced hepatitis. Heavy alcohol use, toxins, medications, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. While hepatitis A and B usually cause outbreaks, hepatitis B and C infections lead to chronic liver disease and complications like cirrhosis and liver cancer. Globally, there are an estimated 257 million people with hepatitis B, and every year 900,000 people die due to hepatitis B-related deaths. An estimated 71 million people are infected with hepatitis C each year, and around 400,000 people die each year. How do we avoid this party pooper disease? Less alcohol consumption, get vaccinated, have good hygiene, and avoid contact with contaminated objects or bodily fluids. At number 6, we're dealing with measles. Measles is a highly contagious airborne disease caused by a virus that can lead to severe complications and death. It is so contagious that if one person has it, 9 out of 10 people of all ages around the infected person will also get infected. The virus is transmitted by breathing in the contaminated air or touching the infected surface, and then touching their eyes, nose, or mouths. Measles presents with a high fever, cough, runny nose, and a rash. Despite vaccines, it still impacts millions globally, causing numerous fatalities. About 1 in 4 individuals will be hospitalized and 1 to 2 in 1,000 people will die from measles. How can we avoid it? Community-wide vaccination is the most effective way to prevent measles. Also, wash your hands frequently and avoid contact with contaminated items. Breaking into our top 5, we have influenza. Often underestimated, this notorious bug, also known as the flu, is a contagious respiratory illness that can cause mild to severe illness, and at times can lead to death. Symptoms range from fever and cough to severe complications like bacterial pneumonia and congestive heart failure. Influenza is transmitted by droplets and small particle aerosols spread through coughing, sneezing, talking, and breathing. It may also be transmitted through direct or indirect contact with infected respiratory secretions on surfaces and objects. Globally, it's estimated that there are 1 billion influenza infections each year. It is estimated there are 3 to 5 million cases of severe illness, and between 290,000 to 650,000 deaths due to flu each year. So it's not just a simple case of the sniffles, it's a global health concern. The most effective way to prevent influenza illness and its complication is vaccination. Get your flu shots, folks. At number 4, it's the infamous pneumonia. This is no ordinary cold, folks. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing them to fill with fluid or pus. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. Pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than the age 65, and people with existing health problems. Symptoms can include cough with phlegm, chest pain when you breathe, fever, and shortness of breath. How does pneumonia affect us globally? Pneumonia is the leading cause of death for children under the age of 5 worldwide. Also, pneumonia causes more than 1 million hospitalizations and more than 50,000 deaths each year. So, consider this a public service announcement. Stop smoking and take care of those lungs. And a good reminder to cover your mouth when you cough. For number 3, we have diabetes. Now, this isn't about your sweet tooth running amok. Diabetes is a chronic disease affecting the way your body metabolizes sugar. It's like having a party, but your body forgot to hire a bouncer, and now sugar is crashing all over the place. There are 2 types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes occurs when your immune system, the body's system for fighting infection, attacks and destroys the insulin-producing beta cells of the pancreas. Exact cause of type 1 diabetes is still unknown. Scientists think genes or the environment may be responsible for triggering type 1 diabetes. Type 2 diabetes, the most common form of diabetes, is caused by several factors, including lifestyle factors and genes. You are more likely to develop type 2 diabetes if you are overweight and obese. Symptoms of diabetes can range from frequent urination, increased thirst to unexplained weight loss. Common diabetes complications include heart disease, chronic kidney disease, stroke, foot health, vision loss, and nerve damage. Approximately 537 million adults are living with diabetes. It's a silent stalker lurking in our everyday lives. Sugar isn't always as sweet as it seems. Just missing the top spot at number 2, it's cancer. Cancer is a disease when abnormal cells divide in an uncontrolled way and have the ability to destroy normal body tissue. There are more than 200 different types of cancer. Cancer is a heavy hitter. It is the second most common cause of death in the world. Symptoms vary widely but can include fatigue, unintended weight loss, unexplained bleeding or bruising, unusual lump or swelling, bladder changes, and skin changes. Globally, it's a major health issue. In 2020, there were an estimated 18.1 million new cases of cancer worldwide. There were an estimated 10 million deaths from cancer worldwide in 2020. The 4 most common cancers occurring worldwide are female breast cancer, lung cancer, bowel and prostate cancer. Consider these lifestyle tips to prevent cancer. Maintain a healthy weight, be physically active, eat a healthy diet, and regular body checkups. Cancer is a silent invader, often undetected until it's well established. A good reminder that not all enemies can be seen. And now, the moment you've been waiting for. The deadliest disease at number 1 is heart disease. Heart disease is the leading cause of death in the world. This silent killer is a group of conditions affecting the heart and blood vessels, which include coronary heart disease, cerebrovascular disease, rheumatic heart disease, and other conditions. Symptoms can be as subtle as fatigue or as severe as chest pain. Heart disease claims an estimated 17.9 million lives each year, making it the #1 cause of death in the world. The key in the battle against it? Lifestyle changes and early detection. Eat a healthy, balanced diet, be physically active, maintain a healthy weight, give up smoking, reduce alcohol consumption, keep blood pressure under control, are all keys to avoiding a heart attack. Remember, a healthy heart is a happy heart. That brings us to the end of our countdown. From the 10th to the deadliest, these diseases underscore the significance of prevention and early detection. Let's not forget, we're stronger than any disease. Stay healthy, stay safe, and remember, knowledge is power.